1.8 million Canadians live with ADHD. And while it is often recognized in childhood, as we know, many people are getting diagnosed later in life. And that can bring a sense of relief, but it can also come with a feeling of what's next? Now, what do I do? This morning, mental health expert Calissa Ngozi joins us to talk about self-care strategies. Good morning to you.
Good morning.
So good to have you on. So you were diagnosed with ADHD as an adult. What was it like hearing that diagnosis for you?
It was like, okay, that tracks.
Right.
That makes sense.
Right.
You know, I was able to see ADHD characteristics in other people around me, but I wasn't able to see in myself until they said, no, for sure, you have ADHD.
Was it a sense of relief in a way?
It was,
yeah.
Because it kind of made me understand that what I thought was my normal made more sense, right? So the things that I was doing, the things that I was struggling with, okay, well, I have an ADHD brain, so it works differently than a neurotypical brain.
So once you had that information and that knowledge, what did you do with it? What lifestyle changes did you make?
Well, right away I thought, do I need medication? Do I need chemical intervention? And I tried it, and I think that there is, you know, a proponent for that for a lot of people. For me, not so much. It was really setting boundaries. It was looking at how can I manifest a normal, quote unquote, life for myself with an ADHD lens. So a lot of strategies I needed to change in my day-to-day life.
I want to walk through some of these strategies. Something called body doubling. I haven't heard of this. What is this?
So body doubling is, in essence, having someone there with you. So whether it's virtually or whether it's in person, they don't necessarily need to talk, but having them there in presence to kind of help you get through, you know, writing a book, you know, going through routines, you know, things of that nature. It's having that presence that helps limit the anxiety that you might feel.
You mean like physically having somebody with you?
Yes.
In every facet of your life? Like,
well, not every facet
like
of your life. So maybe I'm going through something right now, you know, some sort of trauma or something that's going on in my life. So I might call a friend and say, listen, I don't need a therapy session, but do you mind just kind of hanging out with me at home? We don't necessarily need to talk, but having you there and having you present helps with my nervous system.
Oh, so interesting. What about sensory kits? How do you feel about those?
Right. So I don't know if you remember, about 3 or 4 years ago, like pop sockets were the rage. And fidget toys and all of those things. So having a sensory kit is really helpful when you're starting to feel overstimulated. So things like textured fabrics or chewing peppermint gum, maybe throwing in your earbuds, whatever it is, so that stimulation, it helps you with your emotional dysregulation.
Peppermint specifically?
Peppermint, because it kind of triggers something in your brain because it's spicy, right?
Yeah.
My kids call it spicy gum.
Yeah.
So,
everything is spicy with them.
Everything is spicy. And you know what's funny is I actually identify as being neurospicy, so it works.
Oh, that's so funny. Obviously, sticking to a routine can be quite challenging. So how can anchors help with that?
So really what we mean when we say anchor is we're bookending our day. So if we have a morning routine, I know that I need to get up at 7 a.m. because my kiddos need breakfast. I need to make their lunch for school. And then I start my routine. So whether it's having a glass of, you know, Earl Grey tea, having my shower, you know, practicing mindfulness. And then I also know that at the end of the day, you know, at 8:30 p.m. when bedtime is over in terms of my kiddos, then it's me time. So I'm either reading a book, I'm scrolling on my phone, but it's that predictability that helps just in case, again, if I'm feeling overstimulated.
And did you not do any of this before your diagnosis?
I was all over the place.
You were?
Yeah, and I find people with ADHD thrive on structure, but it also has to be limited. We can't look at something of, okay, so I'm gonna have a goal that's 5 years away from now. That's too long. We need to do things in short intervals of time so that we're not overwhelmed.
And setting boundaries too, you say, is really important.
Let me be clear, no is a complete sentence, and that's something as a society that we really need to embrace, right? Because if we don't have boundaries, then we're gonna be overwhelmed. We're gonna be overstimulated. You know, relationships, whether it's personal, professional, or romantic, they're gonna be affected because we're dysregulated. And when we're dysregulated, people around us are gonna feel it as well.
How difficult was to go from living your life as you've known for, you know, X amount of decades to getting the diagnosis and then switching gears?
For me, it was quite easy because it was almost like an aha moment and I felt a sense of calm. Okay, Calissa, now you have this label. What are you going to do with it? And how are you going to help everybody else in your life that might be dealing with it as well?
Do you ever deal with the stigma with family members?
No, they understand. And they're like, Calissa, it makes absolute complete sense. We saw it.
Yeah, we saw it first.
Thanks.
Calissa, fascinating. Thank you so much for this conversation today. It's super important.